of Physical Therapy at Bellin College. Welcome to tonight's DPT info session. We like to do these a couple times a year to really provide you with lots of information about our program as you are considering your future career as a physical therapist. So at Bellin College, we, first of all, logistically, feel free to put any questions you like in the chat as we go. I got a lot of questions from you all that were submitted to our admissions department. So I have all those written down, and I'm going to go through those at the end. So I've got some kind of pre-populated questions that people are already asking. But if you have questions as we're going along, feel free to throw anything in the chat. If you want to mic up and ask your question, that's cool as well. But I'm just going to kind of go through a little bit about the details of our program and help you kind of get to know us a little bit better. And then we will have time at the end for more questions if you have them. So Bellin College, we are a healthcare-focused institution. That's kind of what we do. And we have actually three physical therapy programs. And so we have a Doctor of Science program, which is for physical therapists that want to go back and teach and do research. That program is nationwide. We have faculty and students all over the country. They do their research with Bellin Health and Gunderson. So we have like our health partners that provide kind of the research arm of that program. And it's been really successful. That program has been around since 2019. We already have to date over 60 publications, peer-reviewed publications, and it's a really strong research program. We also have an orthopedic manual therapy fellowship. So just like in medicine, you graduate with your DPT. If you wanted to specialize, you could go on to do a residency. If you wanted to subspecialize even further, you could go on and do a fellowship. So that exists in the physical therapy profession, just like it does in medicine. The difference in the physical therapy profession, it's really not required. You don't need to do a residency to practice as a physical therapist. You could easily go specialize in orthopedics without a residency. But if you wanted that advanced training, we also have an orthopedic manual therapy fellowship program. That's also nationwide. It's all over the country. We have faculty and students all over. And kind of the hub of that program is our program, obviously, in Green Bay. But both of those physical therapy programs are not brick and mortar programs that exist in Green Bay on campus. Only the DPT program does. So our DPT program is, I didn't hit record yet. Oh, no, I did. Our DPT program is the only brick and mortar physical therapy program that we have. So it's housed on our Van Aston campus. I'll show you some pictures of that here in a second. This is our Resch campus on the screen right here, which is kind of the original, more recently developed Bellin College campus, the original campus for our nursing program and our undergraduate programs. But we're excited about getting into the program for Doctor of Physical Therapy. I was a faculty member for 15 years before coming to Bellin at another physical therapy program. I actually live in Northeast Florida, kind of oversee all of our remote programs. And then we have an assistant program director who's in Green Bay every day, kind of running our Doctor of Physical Therapy program. But we really needed a Doctor of Physical Therapy program at Bellin because there were no programs in Northeast Wisconsin at the time. We created a program at the same time as Stevens Point created a program. And so kind of we're the only two programs in that region of the country. And when we did all of our surveys and stuff, we realized that all of these clinics in the area, they really had a hard time hiring physical therapists. There's a shortage of physical therapists in the region. And so that's kind of the idea behind this program. But we view doctors of physical therapy and the people that we want to graduate as not only experts in human movement, who help people obviously recover from injury like you're familiar with, but really, we take a health promotion and prevention angle to our practice as physical therapists at Bellin College. So a lot of our curriculum has to do with prevention, nutrition, health promotion, exercise for the purpose of fitness and wellness, sleep, recovery, stress management, all the things that help you become a healthier human being, because we understand that really our healthcare system in the United States is on an unsustainable path. And we believe that the model of waiting for people to have heart disease, cancer, diabetes, total knee replacements, osteoarthritis, joint-related injuries, like waiting for all that to happen and then treating people just isn't working. And so we have pretty significant concerns that the healthcare system that we currently all know is really on an unsustainable path. And so we believe that the physical therapist should have a leadership role in healthcare in preventing disease and injury when able to. And so that's really what we're trying to train is the doctor of physical therapy of tomorrow takes a leadership role on turning the whole thing around, because a lot of those conditions are preventable. Heart disease is for the most part preventable. Diabetes, type 2 diabetes, for the most part preventable, right? These are all conditions that if you catch them early and if you intervene with good nutrition, with exercise, with a healthy lifestyle, you don't have that problem later on. And that's really what we need in the United States badly. We encourage you to shadow all sorts of different practice settings. The traditional practice settings for physical therapists, obviously, outpatient orthopedics, acute care hospitals, skilled nursing facilities, home health care, and then of course you have specialty settings like pediatric settings and neurological care settings and stuff like that. But right now, what you're seeing an emergence of in our profession are physical therapists going and opening up practices in these non-traditional settings. And so, going to open up a practice in a CrossFit gym, going to open up a practice in a facility like a wellness facility, industrial rehab settings is really, really important. I've had students who go on to work in Cirque du Soleil, who go on to work on Broadway, who go on to work for sports teams, for professional, NFL, NBA, NHL, Major League Baseball. Really, the physical therapist is starting to gain a stronger role in all of those non-traditional settings. Sometimes it takes different levels of training. I mean, I can give you stories of different students. Like if you told me my goal is to make it to the NBA, I can tell you exactly what the recipe is for that. But it's typically, usually those NBA physical therapists have advanced training, either a residency or a fellowship, and then it's a network, right? So you just have to get in with get in really. I just had actually my friend the other day for the Charlotte Hornets just emailed me. He said, I need somebody for our G League team, and that's how you get in. You get in at the minor league level, and then you kind of work your way up pretty quickly. Most of those people work their way up very quickly. This is our mission statement. I don't need to read it to you, but those keywords that are highlighted are really important to us. So altruism, we want to graduate people who really care about the greater good, who care about promoting health in society and helping their community more so than themselves, right? Putting others ahead of yourself. Caring, really doesn't matter how good of a clinician you are. If you don't have that level of empathy and caring and gratitude for the patient in front of you, it really tends to, you're leaving a lot to be desired. We promote excellence. That is a big thing to us. So we want to push our students. We want people who are tough-minded, who are going to come into this program and be ready to get to work. The only way you're going to grow and develop as a human being, as a clinician, as a professional, is if you get pushed outside your comfort zone. That means taking really hard exams. That means having 2, 3, 4 exams in 1 week. That means doing lots of different assignments and writing papers. And I was just talking to our third-year class the other day, and they were complaining about a bunch of stuff. I'm like, what do you think is going to make you better? Like, you're complaining about the workload, but like an easy, light workload should make you mad. You should want to be pushed. You're paying the tuition. You should want us to push you. If we're letting you off easy, letting you off the hook, that's not promoting excellence, and that's not what's going to make you better. So, I always tell people, if you're looking for a school, a program that's going to be kind of like easy and you're going to be able to have sort of a nice balanced lifestyle and all that sort of stuff, that we are not the one, because we really want to push people. We believe in having fun. We definitely want you to have your fun. We want to create a fun environment and a social environment. We are like a family because we're a small program, but at the same time, we want you to be great. We want to push you to excellence. We want you to be leaders in the profession and in your community and in your businesses. We want you to be committed to lifelong learning, because what you learn in school is going to get outdated really, really quickly, right? I went to PT school in 2002 to 2005. If I had stuck with what I learned at that time, I would have been outdated a long, long time ago. There's new emerging evidence. The science in our profession is gradually progressing so frequently now, you have to keep up. And so what we do in our research courses is we train you to be able to interpret research so that when you graduate, you can take new emerging evidence and integrate it into your practice. That's really, really important. We believe strongly in service. I'll give you a bunch of examples of that, and advocacy, because we have to fight for what we believe is the right thing for our patients and our profession. Nobody else is going to do that. It's up to us to advocate, right, for ourselves and for our patients. These are some of our other programs. I already talked about our physical therapy programs, but we were actually founded in the early 1900s. A physician by the name of Julius Bellin, who opened Bellin hospital at the time. He was the owner of the hospital, but he needed a place to train nurses. He knew that there was a shortage of nurses in the area, and so he created Bellin College for the sole purpose of training nurses to work in his hospital and the other area hospitals. And so it's our nursing program has been around for over 100 years. It's kind of crazy to think about that, what it's become today. But in the kind of the mid 90s, they started to really expand outside of nursing. And so we now have a diagnostic medical sonography program, radiological sciences. So MRI technicians, X-ray technicians graduate from Bellin College, and then surgical assistants. You actually take classes with our nurse practitioner students. So we have a doctor of nurse practitioner. You take your ethics course with them. And then we do a lot of collaborative work with our sonography team. So musculoskeletal sonography is an emerging area in the physical therapy profession. I'll show you some pictures of this in a little bit. But we really take advantage of that. So I'm trained in diagnostic sonography. We have another faculty member that's trained in it. And so I travel to campus and I do a lab for you where I teach you how to scan every joint in the body, because we believe that that's an emerging area in the physical therapy profession. 5, 6, maybe 10, 12 years from now, you're going to see a large chunk of physical therapists performing sonography in the clinic. And so we really want to be on the cutting edge of that. And the reason is because those machines are getting cheaper and cheaper. They're much more affordable today. So there's a small percentage of physical therapists that are trained in it today. We introduce it to you while you're in school because we think it's a really important thing to have some background in. This is our Van Aston campus. This is the lobby. So it is a separate campus from where our nursing program is and where our bachelor's degree program is. It's a small campus. It's healthcare focused. We are all about getting out of business. So if you're looking for a school with like a football team and a football stadium and all those kind of extracurricular things, that's not what us. We are laser focused on creating exceptional physical therapists. That is what we do. We really don't have any of the other fluff like in the college experience that you would get in like your typical undergraduate program. On the right is our one of our labs. So this is our lab that has our high-low tables in it. This is where we teach you all of your manual therapy techniques. We do a lot of our exercise labs in there, and then we have some other facilities for that sort of thing too. So, we're really into hands-on, we're really into the manual therapy approach. What we teach in our manual therapy labs is cutting-edge, evidence-based manual therapy and manipulations. You learn how to manipulate the spine. You learn how to manipulate every single joint of the body, because we know that is a critical element to care. Physical therapists are one of the only healthcare providers licensed to touch patients, right? We need to utilize that tool that we have, that manual therapy tool that we have is so important. This is one of our lecture rooms. This is our first cohort. Our inaugural cohort had 23 students in it. They started in 2022. They're going to graduate this upcoming May here in 2025. And then the class behind them, the group that started in 2023, there are 28 of them. And then our optimal class size is 34, and that's what our group that just started here in 2025. This is one of our exercise labs here. But we utilize the Bellin Health Titletown facility a little bit. So this is right next to Lambeau. This is kind of Bellin's flagship physical therapy rehab center. It's there's surgeons that work there, and that's where they do their kind of like a lot of their sports med team works there. But then we have a whole huge rehab clinic and then strength and conditioning facility there. So for like us, for your motion analysis lab, for your overhead throwing athlete, that's done there. We do some of our exercise labs over there just because they have like lots of squat racks and stuff like that. Give us a little more space to do what we got to do. We actually collaborate with St. Norbert College. So St. Norbert College hosts our cadaver lab just the same way they host the Medical College of Wisconsin in Green Bay. They host their cadaver lab as well. So Dr. Deborah Anderson, who you see in the middle there, she is the anatomist who's been an anatomist for 30 years. She's an amazing instructor. We love Dr. Anderson. She's such a good anatomy teacher. And she teaches the medical students. She teaches the biology students at St. Norbert's, and then she teaches our DPT students. So she's so good at teaching anatomy across all these different disciplines, and really, really popular course. That's in your first semester. So you start with anatomy in your first semester, and you go to St. Norbert's twice a week to go into the cadaver lab with Dr. Anderson and all of our DPT anatomy faculty as well. That is our second cohort, our 2023 cohort. And every single thing we do is focused on your outcomes. So what's nice about us is we are small. We meet as a faculty every single week. We are constantly communicating with one another, and we are pivoting and changing on a dime. So we find something that isn't working, that's not creating what we believe is the optimal physical therapist, we will immediately pivot and change that. That's what I love about this program. I was recruited to come to Bellin, and it was the best decision I ever made because it is a nonprofit institution, and the upper management listens to us. That's what I love about it. When I say things to them like, hey, we need X, Y, and Z, this is what's going to help our students. They listen to us and they respond. And honestly, I don't like saying this publicly, but I've never heard no. I've never heard no from our upper management. We have the best president and CAO that you could ever imagine. And that's why it's really, really a wonderful place to work. We're big on you getting out, you and our faculty, everybody, all of us, getting out into the community and serving the community. So we believe that a lot can be learned when it comes to public service. We believe that the physical therapist is duty bound to serve the community. And so we kind of like our students to have a lot of experiences outside of the classroom serving the community. So this is a rock climbing gym, and they wanted to have adaptive rock climbing for people with different disabilities. And so our students were able to go over there. Actually, one of our students, I think, got certified in this approach to rock climbing, but our students go over there and volunteer their time. When there's opportunities like 5Ks and different fundraisers and walks and stuff like that, we tend to go to those and attend those. We have a wonderful collaborative relationship with the YMCA. I should have a picture of that here shortly. And this is kind of cool. So our students decided, we knew, like, I had a lot of experience at my prior institution. I created a pro bono physical therapy clinic where we went out into the community and treated patients who needed help, right? We kind of always wanted to do that, but we were sort of like, it's a new program. We got to develop the curriculum. We're creating all these new courses. We got to get accredited by CAPTE. We have so much to do. We weren't really ready to do it. And our first group of students said, no, we want to have a community-based clinic where we can treat patients and help the community for people who are underserved. And so we're like, all right, we'll do it. So we ended up creating this in the first year of the program's existence. Absolutely amazing. What we did was we created, because we were like, all right, if you guys want to do this, then you're in charge. So we created a student board of directors, and the students actually run this clinic. We pay some of our faculty to go over there a couple days a week to mentor the students, and then we have an advisor, a faculty advisor, who kind of helps the student board. But the student board makes all the decisions. They're the ones that are involved in the marketing, the recruitment, the physician relationships. They look at the scheduling and patient, all the patient communication elements of all that sort of stuff. They handle all of that. So it's a student board. And if you're interested, you can become on the board. So what we like to do is always have some senior students who are like towards the end of graduation. They've had a lot of experience. They've been on the board for a long time. But we also like to recruit new students. So when you're in your first year in the program, if you want to get involved, you can, because we just always want to have kind of a alternating group of newer students and more experienced students. I would say this: the program is what you make it. So this is Alex Shutter. Alex is on the right. Alex is about to graduate in May, so he's in his second to last semester of the program. And he approached us early on. I think it might have been when it was like first or second semester. He said, my goal is to be a physical therapist on like the PGA Tour. Like, I want to be a golf specific physical therapist, or I want to open my own practice specific to golf. And I was like, all right, like, I can connect you with a guy. I have a guy down here in Florida who does that. That's what he does. His whole practice is just focused on golfers. That's all he does, is treat golfers. It's a cash pay clinic. He's had a lot of success. He's one of my former students. So Alex said, I'm gonna connect us. I will fly down there and shadow him for a day. So that's Leighton on the left is the golf PT who's in Tampa, St. Petersburg area, and been doing this for several years now. And so Alex, he invited Alex to come to his clinic. Alex, on his break between semesters, flew down there, hung out Leighton for a couple days. Leighton then connects him with all these people. Now Alex is like in the golf world. He's going to the U.S. Senior Open. He's the golf PT there. Already still as a student, he's treating golfers under the supervision of experienced physical therapists. This is the physical therapist that he worked with at the last event. But he's already on the trajectory to start his career in this area that he has this niche sort of practice interest in. So I just think that's really cool. And I think the main thing is like, if you're into something, we need to hear about it because we will help you achieve your goals. It's going to be up to you to put in the work, but between our fellowship and our Doctor of Science program and our faculty who have a lot of experience in networking, like there's somebody we'll be able to connect you with that you can, utilize to sort of make that happen and achieve your goals. The nuts and bolts of our program, we take one cohort per year. So we are a small school. We have 34 students per cohort. The maximum number of students that we can take is 37 under our CAPTE accreditation status. So we don't ever intend of getting any larger than that. We like the small class sizes. It helps us a lot with the faculty to student ratio. It helps us a lot with having quality internships. I taught at a school once that took classes of 75. I know what the difference looks like between even if you have more faculty, it doesn't matter. A high number of students in the classroom, 75 students, 60 students, whatever, compared to 35. I know what that looks like. And it is a dramatic difference in quality. And so we're very passionate about keeping our class sizes small. We do 15-week semesters. So you take trimesters, basically. You go in year round. And there's 8 of those 15-week semesters to graduate from the program. So the total duration is 2 years and 8 months total. We are currently a candidate for CAPTE accreditation status. So we achieved that status when we had CAPTE come and visit us a couple of years ago when we first started the program. The way it works in DPT education, if your college wants to create a DPT program, you basically have to file for CAPTE accreditation status. You have to submit hundreds of pages of documents to prove the program is of good quality. They then come and they visit you. And after that visit, they deem whether or not you can be a candidate for accreditation status. That's what we did back a couple years ago, and we got candidate for accreditation status. Then what they do is they want to see your first cohort, that first group.